Now, Tash is a clinical psychologist.
Yeah, that's correct.
Maybe just to help us, I feel like we're on a session, on a therapy session at the moment.
How are you feeling, RJ?
Yeah, like I'm about to air out all my dirty laundry here. But can you introduce yourself? How long you've been coming to TBC, what you do for work, how long you've been doing that, and really your qualification as a mental health practitioner.
Yeah, sure. I've been working as a psychologist for over 20 years. I work for the Department of Health and do counselling for teenagers with a lot of complex problems and with their families or carers. A lot of the kids are in care. I'm a clinical psychologist. A psychologist has about 6 years training. A clinical psychologist has about 8 years training, but we kind of do the same type of things, which is lots of counselling. And I came to this church, in 2019, I was having a pretty tricky time. The church I was going to in Balmain was kind of falling to pieces and my mum was dying, and I thought it'd be great to have a Christian community close to home. So I contacted this church and said, can I join a life group while I'm trying to transition out of my old church? And they put me in a life group with John and Lindsay, Heidi and Tash and Darren, which has been fantastic. And so then in COVID, I couldn't travel to Balmain anymore, so I started coming here in person. So been here since, 2020.
Now, being a clinical psychologist, I used to be really confused with a psychiatrist, a psychologist, and then a counselor. Can you just, in layman terms, can you just kind of explain the differences between them three and what they kind of do?
Sure. A counsellor is a general term that can be used for all those three. You do counselling to some people. So a counsellor is someone who sits with you and talks through the challenges you have, helps you work through your goals or things you're wanting to change. But there's no kind of regulation about who can call themselves a counsellor. Whereas a psychologist does do counselling, but you have to be registered to be a psychologist. Like an electrician or an accountant, you have to have a registration board that you're connected to.
That requires certain qualifications.
That requires a psychology degree and often a master's degree. And psychologists tend to want to do types of treatments that have a lot of evidence for them. That can be really helpful, but counsellors can do those same treatments as well. And sometimes those treatments don't fit for people. So you might go, I'd prefer to go to a counsellor whose way of working works for me. Because it is a bit personal, right? This is talking about yourself, talking about your issues. So you want to find someone who connects. So you might have had an experience of, I went to a counsellor or a psychologist, it didn't work. That doesn't mean it's never going to work. It might mean it wasn't the right time or it wasn't the right match for you.
Yeah, I think that's very important. Like having the right match of the person that you're doing it with, it really makes a big difference. Is that right?
Yeah, absolutely. And there'll be some people I've seen where I've gone, this isn't the right match, and have suggested they see someone else.
Yeah.
And that's fine. That's not me failing or them failing. That's us working out this wasn't the right match. So yeah.
And a psychiatrist?
A psychiatrist is a doctor. So they've done their medicine training and then they've specialised in psychiatry. So they're more likely to give you a diagnosis, and they're the only ones who can prescribe medication. And so you're less likely to see a psychiatrist every week or every fortnight for counselling, more likely every 3 months, 6 months or 12 months where they manage your medication.
Yeah, so most people would be seeing like a psychologist or a counsellor, and for more kind of extreme mental health struggles, they'll often be referred to a psychiatrist for medication.
Yeah,
right?
That's correct. Yeah.
Yeah, and I think we were talking about this a few weeks ago. That again, like finding the right match, because so psychologists can diagnose medical illnesses like depression and so on. Is that right?
Yeah, they can. Yeah.
Yeah, but they can't prescribe the medication.
That's right, yes.
Yeah. And so most people will be seeing like a psychologist and a counselor. So if they're going through extreme grief, like they just lost, I guess, like a loved one, and they're finding it really hard. So they're more likely to be able to see a counselor and a psychologist, all right?
Yeah, a grief counsellor or a psychologist to support them through that. But someone with an anxiety disorder could absolutely go to a psychologist or a counsellor to get support around that.
Yeah, and next week we're actually going to be interviewing a GP, because often that can be the very first step of like, because then people are kind of confused, like, what do I do? Do I book in a counselor? Do I just go through Google and look for a psychologist and so on? But often, like, the first step is really go to a GP, and then they can guide you from there.
And a GP can also put you on a mental health care plan, which then gives you the capacity to do 10 sessions with, say, a psychologist, where Medicare pays for a good chunk of that. So that can be really helpful when all of us are struggling with money.
Yeah. Now let's talk about anxiety. So what is anxiety? What's happening with our body? And just the different facets of anxiety.
Well, we all kind of know what anxiety is, don't we? Because we feel it. Like this morning, we might have gone, where did that hour go? Rush, come on, guys, let's get to church. We worry about things, and that can be really helpful, as you talked about before, when we're worried about our exam, we study more for our exam. When we're worried about our friend, we might reach out and ring them and check in with them. And fears also helps our bodies when we are in danger. So our body has an everyday way of responding that's really useful for doing all the things bodies need to do, and then it's got the fear response. And the fear response is really good if you're in danger. So it'll make you like hide or run or fight, and that's all it's focused on. So when you're in that fear response, your body's like, let's deal with this danger.
Is that when adrenaline kicks in as well?
That's when adrenaline kicks in, right? And that's fantastic if you're really in danger. But I think what happens with an anxiety disorder is you're getting that fear response when maybe the danger is not that life-threatening, and so your body is going into this fear space when really it doesn't need to be in that fear space, and that's not great for your body, it's not great for your mind, and it's really distressing and difficult.
Because of the prolonged kind of anxiety that's happening,
Yeah, and it's meant to, that's meant to deal with this danger for this, 10 minutes. It's not meant to, you're not meant to be in that state most days for most of the time, which anxiety can put you in.
Yeah, okay. So then I guess that kind of leads to other medical kind of problems of, I don't know, like increased heart rate or, is that right?
Yeah, sometimes we can have what's called a panic attack, which is when the anxiety just overcomes our body, our heart rates goes very high, we struggle to breathe, we're really distressed, we think we're going to die, right?
Yeah.
Many of us will have experienced this. And so those panic attacks are very difficult to deal with. And they're very present in lots of anxiety disorders, but they can make us not want to do things that, I don't want to go to that place because what if I have a panic attack? And so we start avoiding. And anxiety disorders are really associated with avoiding situations because we're afraid. But that then impacts our life because we can't do the things we can't. So all of us have anxiety that stresses us out a bit, but when we've got an anxiety disorder, we stop doing things we really want to do. We find it difficult to go to school, to interact with our friends, to go to work, and so it's significantly impacting on your life, and it's very distressing.
Yeah, and you sent me some other examples of anxiety in the slide. Can you kind of walk us through some of them again?
Yeah, one of the very common types of anxiety disorders is generalised anxiety disorder, and that's when we are worried a lot about a lot of things, and just that worry, our brains are generally going very fast, we're generally agitated, like up here, things can set us off very easily, and it's really impacting our lives. You can have a specific phobia, which you might think a phobia of dogs or spiders or injections or crowds, and that's more specific to those set things, and we'll avoid situations where we might be close to dogs or crowds.
Yeah, and sometimes, is that why people sometimes pass out having an injection? Because their body just kind of tries to safeguard itself?
Yeah, so our mind and our body are very closely interacting. And so, when we're stressed, our body kind of protects itself, which can be very helpful in a fear situation, but not very helpful when we need to get a COVID injection in order to keep our job, right? It becomes a real issue,
Yeah. Keep going with the other ones.
So social anxiety disorder is when we don't want to be, when we're really afraid of social situations. So you talked about talking up the front here. It's a bit stressful, right? And so that can be a worrying situation, but if you've got social anxiety, you wouldn't even think of coming up the front. You'd be so distressed by the thought of it. You don't want to be in any social kind of setting because it's so distressing, which you can imagine really impacts life. And what happens with this kind of anxiety is you're thinking the bad thing that can happen is really likely, it's going to be really bad, and that you are not going to cope very well. So for both of us, we probably feel a little bit anxious about being up here, and we're worried maybe we'll say something a little bit dumb, and maybe a couple of people will think, didn't like what they said.
Yeah.
And we think, but probably we'll be okay, right? The anxious person will think, I'll definitely say something really dumb, and everybody will hate me, and there's no way I will cope. So your brain is taking your worries and making them extreme so that you then can't cope with situations, and then you avoid all those situations. And the last one is panic disorder, and that's when you're having panic attacks quite often and you're avoiding, again, situations. So I won't go to school because what if I have a panic attack at school? I won't go to work because what if I have a panic attack at work? I won't go to the shops because what if I have a panic attack at the shops? And so again, you're withdrawing from the everyday things you need to do in life. And it's very hard. So most of us will know someone with an anxiety disorder or will have had one, and it's very hard to deal with.
And those are just few examples. So there's a whole plethora of other anxiety disorders. Now let's talk about treatment, and we've kind of touched on it. So what does treatment look like for people suffering from anxiety?
Well, as we said, it affects our body and our thinking, and so you're trying to work at both those things. So we're trying to help people understand with their mind, help their mind go, actually not everyone is going to hate me. It's not 100% likely that I'll ruin this situation, and that I do have coping skills. So you're trying to help people learn those skills to control the worry, to live in the moment a bit more, like not always think, but what if, but to live in the moment a bit more. And we want people to think about their values, which is great for us to be doing as Christians, think about what we hope for in life and go, actually, in order to get those things we hope for, we're going to encounter discomfort, we're going to encounter pain and challenges, and that's okay because we're heading towards
it's almost like normalizing it.
Yeah, that's right. Rather than, I feel discomfort, let me withdraw. So anxiety wants us to feel the discomfort and go, no, get away from it. So we go to our screen, we do online shopping, we go for a run, we clean the house, we do all these distracting things. How do we feel? Much better, right? And so then the next time that difficult thing comes up, we go to that distraction again, and then we go to it again and again, and we get less likely to do the scary thing, and we lose those skills of being able to go, no, we can face discomfort, we can get through things, and you withdraw, and so you don't do the things you want to do in life. So one of the therapies is to expose yourself to those difficult situations so you get better at it. So I assume you're better at getting up the front and talking in terms of your anxiety than you were when you first started, because you've just done it enough times that you go, okay, I can manage this. So we want to teach people to face their fears. And the other thing with our bodies, we want to teach people body skills that can help them face their fears. So I'll probably go for a walk after this because my anxiety level is a bit high and I want to get that out of my body. You also learn breathing skills. So we want to breathe out that yucky energy and then breathe in some good stuff. And as Christians, I often say a breath prayer like, be still and know that I am God. Or something like that, just to help our brain and our body take a moment and then we can calm down. And the other thing is our body gets very tense, and one of the ways to relax our body is actually to make it tense. Should we get them to do something?
Sure, if you think it'll be helpful,
So let's do raw spaghetti, cooked spaghetti. So raw spaghetti is really straight and tight, and cooked spaghetti is really floppy, all right? So everyone be raw spaghetti, as tight, clench everything, be as tight as you can, and then go cook spaghetti, all right? Feels different, okay?
Yeah.
And so we want to teach people with their anxiety to notice, oh, I'm in raw spaghetti state.
Yeah, okay.
I want to learn to be in cooked spaghetti state. And so you're teaching your body to relax.
Yeah. So it's being mindful of what your body's going through. And
Yeah.
And I think that's why a lot of kind of therapies, like if people go through like a psychologist and a counselor, like often what they'll be encountering and pretty much suggesting to them to practice. Is that right?
Yeah, absolutely. You can go to counselling and dig through all your deepest, darkest secrets if you want, but you can also say, I just want to develop the skills to work through my anxiety disorder, and you can just do that.
Yeah.
So they're both options of what you can do in counselling. And then medication is something that you'd go to a psychiatrist for or a GP. And generally with medication, you want to take it for a period of time to help reduce your anxiety to the level that you can then learn those skills and face those fears, and then hopefully not need the medication in the
to ease off it as well. Because I guess it helps to just kind of kickstart the treatment, and then hopefully that you can be able to manage yourself and that your body can manage it itself.
Yeah, that's right. And anxiety treatments are actually found to be quite good and helpful in dealing with anxiety. But it's a bit like fitness. Like to get fit, you have to put in effort over weeks and weeks and weeks. You don't just get fit tomorrow because you say, I'm going to get fit, or you speak to a fitness guru and then you're fit. You actually have to put in work over time, and you get to a point where you're pretty fit, but you probably need to keep working on it over time. And with anxiety, that's the same kind of thing. You build the skills, you get to a point, I can do this by myself now, but you probably need to keep working at those skills over time.
And just lastly, as a Christian clinical psychologist, like how do we kind of integrate faith, church, and anxiety, and of how we manage it?
Yeah. I think the Bible talks to us about what to do with anxiety. In the Psalms it says, take your anxieties to God. Peter says, cast your anxieties on him because he cares for you. I think Paul says, don't be anxious about anything, but in prayer and petition, present your request to God. So those are saying, of course you're going to have anxiety, but bring them to God, and God will support you with them. And actually psychologists are using those kind of techniques by saying, let's not distract ourselves, let's face it. So bringing it to God is facing our fears, is saying...
Like naming it.
Naming it. God, can you help me with this? There's lots of rituals in church life, which is very helpful. So prayer, meditating on God's word, coming to church. If we've got social anxiety, coming to church is a way we can safely connect with others and learn those skills of being in social settings. So that's really helpful, I think. And then as church, we're a family, so we can be brothers and sisters to the people amongst us who are facing anxiety disorders, and instead of offering judgment, we can offer acceptance and kindness. And I just like to think of the fruit of the Spirit around that. Are we offering love and kindness and gentleness? And I think patience is connected to hope, and going, it is kind of tricky for the person with the anxiety disorder, but it's also tricky for the family and friends at times. And so making sure we think about being patient and kind to the people we're with, I think is really important. The other thing I like to think about is that there's sufficient faith in the community for us. So sometimes our faith is just hanging on by a thread, but we look around and we've got brothers and sisters who are strong. And so we can have a time where we're just holding on, but that's okay because there's people with us who are strong. And when we're feeling stronger, we can do the same for our brothers and sisters who are struggling.
Yeah.
And one other thing on the fruit of the Spirit I'd say is, people with anxiety might be listening to this and going, oh, I should have been doing that. I haven't been doing that. Oh, no. Oh. And so also be kind to yourself, be gentle with yourself, be patient with yourself, because it's hard and it takes time to work through this, and that's okay. Yeah.
Well, thanks a lot, Tash. I find that really, really helpful, and I'm sure most people would have as well. Can we thank her for giving her time?